Good morning to another present over here. Today we are going to see about differences in cavity preparation for silver amalgam and class 2 cast gold inlay. So first coming on to definition of class 2 preparations. The preparations required to correct caries lesions that develop in the proximal surfaces of posterior tooth are termed class 2 preparations. Now coming on to differences between silver amalgam and cast inlay. So amalgam restoration is a direct procedure, as we all know, that can be finished in one appointment. Cast inlay is an indirect procedure requiring two appointments, one for tooth preparation and the other for delivering restoration. Amalgam is indicated in conservative and moderate carious lesions, whereas inlay is indicated in extensive carious lesions due to durability, biocompatibility and ability to withstand forces. Amalgam is indicated in young as well as older patients. Inlay is contraindicated in younger patients due to presence of large pulp chambers and in older patients due to lengthy and multi-step procedures. And amalgam is indicated as an interim and caries control restoration, and whereas inlay is contraindicated in patients with high caries rate. And amalgam, there is less control on the placement of proper contours and contacts, and in case of inlay there is superior control of contours and contacts, and it is indicated for diastema closure procedures also. And amalgam, it is inexpensive when compared to amalgam. Inlay is more cost effective to the patient. So coming on to edge strength, that is the resistance to fracture of the bevel extension normally located at the cavus surface margin of dental restoration is less in case of amalgam. The high edge strength is seen in inlay due to precise fabrication of process involved. And in case of amalgam, we have the concern of mercury toxicity since we use mercury in that for mixing with alloy powder. And inlay is biocompatible as high gold dental casting alloys are unreactive in oral environment. Alloys used are noble metals, base metals, and recent alloys such as titanium. And silver amalgam, it is less technique sensitive, whereas inlay is more technique sensitive when compared to amalgam. So there is a picture showing the amalgam restoration on the left side and the cast gold restoration on the right side. So now we will see about each feature in brief. Okay, so coming on to outline form, in case of silver amalgam, outline form is narrow as there is no surface involvement and the walls they will converge occlusally. Whereas in case of a class to cast gold inlay, outline form is wider as the surface involvement is more and the cavity walls diverge occlusally. So as shown in the figure here. Okay, if you see here, the cavity preparation should be wider enough and it should diverge occlusally. Okay. And coming on to cavity width, the cavity width is kept at 1/4 of the intercuspal distance in case of silver amalgam, whereas in case of class 2 cast gold inlay, the width of the cavity may increase up to 1/3 of the intercuspal distance. So here we have, as shown in the figure, 1/4 of intercuspal distance, whereas in case of cast gold inlay, we prepare to a width of 1/3 of the intercuspal distance. So coming on to cavity wall orientation, the cavity walls converge occlusally. Burrs used are number 245 and number 330 in case of silver amalgam. And as we have already seen, the cavity walls we have seen it should have a slight occlusal divergence, and the burrs used will be 271 and 169L. So coming on to occlusal cavo-surface angle, the occlusal cavo-surface angle for amalgam is 90 degree to establish a bud joint with amalgam, and the occlusal cavo-surface angle is 135 to 145 degree in case of class 2 cast gold inlay to achieve a lap sliding fit with the inlay. So coming on to internal angles, the internal line angles are rounded in case of amalgam, whereas in case of class 2 cast gold inlay, internal angle should be well defined. So coming on to beveling, beveling is done only on the gingival cavo-surface margin in case of silver amalgam to remove the unsupported enamel. Okay, whereas in case of, so we do in gingival cavo-surface margin, whereas in case of class 2 cast gold inlay, bevels are placed in both occlusal as well as gingival cavo-surface margin to provide frictional retention. Coming on to gingival bevel is in the range of 15 to 20 degrees. It will be very mild, okay, in case of silver amalgam. Whereas in case of class 2 cast gold inlay, gingival bevel is steeper and is in the range of 20 to 30 degrees. So as shown here, this helps to minimize the cement line. So coming on to undercuts. Undercuts in preparation improve the retention of restoration in case of silver amalgam. Whereas in case of class 2 cast gold inlay, no undercut should be present in the preparation. Coming on to proximal walls and margins, proximal walls are only provided with a primary flare in case of silver amalgam. In case of class 2 cast gold inlay, the proximal margins may show a primary flare. So they may show a primary flare as well as a secondary flare. So proximal clearance. Silver amalgam, proximally minimal clearance is provided, not more than 0.5 mm from the adjacent tooth. In case of class 2 cast gold inlay, proximally more clearance may be acceptable. Gingival seat position. Ideally, gingival seat should be located supragingivally in case of silver amalgam for better working. And in case of class 2 cast gold inlay, subgingival extension of the gingival seat is acceptable if indicated. Secondary retention. Secondary retention is in case of silver amalgam is provided by grooves, slots, pins and amalgam pins. In case of class 2 cast gold inlay, secondary retention is provided by grooves, slots, internal boxes, skirts, collars and reverse bevel. Coming on to reverse curve may be present in the proximal outline in case of silver amalgam. In case of class 2 cast gold inlay, reverse curve is not provided in the proximal outline. Thank you.